Hello, welcome to Be Heart Smart. Thousands of Australians enter hospital each week with a heart condition. We know that there are many key things that you can do to help your heart and your body recover, so you can feel stronger and more confident in your daily life. The aim of this video is to support you through your recovery and help you work towards maintaining a healthy lifestyle. The information in this video is essential as you get ready to leave hospital. In the following video, we will focus on the Managing My Heart Health booklet, which contains information to help you better understand your heart condition, the benefits of participating in cardiac rehabilitation to support your recovery and help you adjust to lifestyle choices, where you can find more information, such as helpful websites and contact details, and we hope our video will give you confidence to adjust, feel stronger, and be more positive.
Six months ago, I was where you are today. I was lying in the bed where you are now, and at first I thought it was a death sentence, but then I realised it was actually a wake-up call. I feel quite healthy now, and it's hard to remember how weak I felt when I had my heart event. Feeling stronger happens gradually, and everybody's recovery is unique. If you feel like taking things slowly, then that is what you need to do. There is no timetable that fits all. The suggested path to resuming activities is a guide only, you know best. By going to cardiac rehabilitation, you will learn more about your heart condition. The cardiac rehabilitation program put me on the path to recovery.
Well, you can make a good recovery, and we are here to show you how. So let's begin with a few key issues, and you will see some of the members of our cardiac team in action.
I want to quit smoking, but many of my friends and family still smoke. Why should I quit, and how can I get help?
Stopping is hard. Smoking is the single most preventable cause of death in Australia. It's a major risk factor for heart conditions and many life-threatening cancers. Smoking is not only harmful to the smoker themselves, but also to non-smokers exposed to cigarette smoke. Cigarette smoke contains thousands of chemicals which are damaging to your heart and your blood vessels. There is no safe level of smoking. Here's what you can do. Use your Managing My Heart Health booklet and refer to the red Quit Smoking Action Plan. You can phone the Quit line, and remember, you can always ask us for help.
There are so many messages out there about what you should and shouldn't eat. My friends are always talking about different diets they've been on, or what they have heard others doing. I'm confused. Is there a special diet I need to be on?
There are several risk factors linked to heart disease, many of which can be addressed through diet modification. However, it is important to understand that there is no special diet post-cardiac event, and searching the internet or speaking to family and friends can leave you very confused. Some people may have more specific dietary recommendations if they have diabetes, are on a fluid restriction, or are on certain medications like warfarin. But you can still achieve a healthy, balanced diet with some basic principles. Enjoy a variety of nutritious foods from all food groups. Limit your intake of salt. For example, choose fresh or frozen produce over canned or packaged foods. Add flavour to your meals with herbs and spices instead of salt. Look for reduced salt products. And try to replace salty snacks with healthier options. Include healthy fats in your diet in moderation. For example, olive oil, oily fish, avocado, nuts and seeds. For more information on how you can achieve a healthy, balanced diet, refer to the green section in your Managing My Heart Health booklet. The action plan will help you to keep track with your dietary goals.
I hear people say I should start reading and understanding food labels, and I've tried. But what am I meant to be looking for?
Understanding food labels is a skill that takes practice. But once you know what to look for, food labels can provide you with useful information. Start by familiarising yourself with the nutritional information panel found on all food packages. Look at the different nutrients. The dietitian will teach you how to read and understand food labels in the cardiac rehabilitation program. The interactive session includes many group activities and allows you to ask any questions you may have. You'll also receive some handouts to help you once you return home.
I used to have a beer or wine with my dinner each night. Can I still drink alcohol? And how much am I allowed to have?
Excessive alcohol consumption is harmful and increases your risk of high blood pressure, heart conditions, stroke, liver disease, and some types of cancer. This does not mean you can't drink any alcohol. There are guidelines to help you understand what is a safe level of alcohol. The guidelines recommend 2 standard drinks per day for men and women, along with 2 alcohol-free days per week. Use your Managing My Heart Health booklet to familiarise yourself with what a standard drink looks like across various different alcohol types. You might find the Alcohol Action Plan useful once you return home.
What activity can I do? And what can't I do? How often should I exercise?
Your speed of recovery will depend on what brought you to hospital, as well as your previous level of fitness. You need to avoid sitting or lying for long periods. For most people, walking most days of the week is a good place to start. Start slowly and build up gradually. At this stage, there isn't one answer to that question, as it will vary with what level of fitness you now have and what exactly has happened to you. If you've had open heart surgery, allow at least 6 weeks before more strenuous upper arm activities such as swimming or mowing the lawn. The important thing is to know that activity is your friend and that there are many ways that you can be active that will be very good for your health and well-being in the short and long term. It can be through an exercise program at home or in a gym, doing either or both aerobic exercise and strength training. The Managing My Heart Health booklet gives a good introduction to what is a safe way to progress your activity routine, and when you join Cardiac Rehabilitation Program, we can be much more precise about how you make regular activity an important part of your life. If you're not able to join the Cardiac Rehabilitation Program, then seeking advice and support from a health professional with knowledge of cardiac rehabilitation will be very valuable to you.
My medication reduces my risk factors by only a certain amount. What else can I do to help my heart be healthier and stronger?
The research is very clear on this and has been for a long time. Exercise and being active can have a positive impact on a wide range of risk factors for heart disease. These include blood pressure, cholesterol, insulin control, that is diabetes, depression and anxiety amongst others. In combination with your medications and other lifestyle changes, it's a very positive way to gain control over what has happened to you. It helps restore or improve your ability to do such things as housework, gardening, shopping, sport and recreational activities, because you become fitter and stronger over time. Think of it as an investment in your future. 3 hours a week, it's great value, and the sooner you start, the better.
How do I know when I have done too much activity?
Our general experience is that most people do too little rather than too much. However, if you become lightheaded, short of breath, get irregular heartbeats or chest pain during exercise, slow down or stop until this passes. If you've been prescribed angina medication, carry them with you when you're exercising and follow your doctor's advice for its use. If symptoms come back, contact your doctor or cardiac rehabilitation professional for follow-up. It's more common to have muscle or joint soreness after commencing an exercise program, especially if you've not been physically active for a period of time. That can be avoided by choosing the right kind of exercise and gradually progressing your activity levels.
Why do I need to take my medications?
Patients with heart conditions are prescribed a range of medicines, some that need to be taken for the rest of your life. Your doctor and pharmacist will explain why each medicine has been prescribed specifically for you. The pharmacist will talk to you about your medicines, explaining how to take them, how they work, the benefit of taking the medicines, how long you need to take them for, and any potential side effects. Some examples of how the medicines may help you are to prevent further blockages of your coronary arteries, control symptoms such as chest pain or breathlessness, lower blood pressure, remove excess fluid, make the heart beat slower, relax the blood vessels, and improve your ability to exercise. The medicines will also help delay disease progression and prevent admission into hospital.
What if I forget to take my medication?
Taking medicines may be new to you. There may be a lot to remember. If medicine doses are missed, the consequences may be mild or could be very harmful. The pharmacist will discuss with you the importance of missed doses for each of your medicines. Ways to remember to take your medicine could include timing the taking of medicine around daily activities such as setting your alarm clock, brushing your teeth, eating your meals or going to work. Other ways may include using a calendar, a phone or having someone remind you. Medicine lists will be provided by the hospital pharmacy and are also available from your community pharmacist upon request. It is important to carry your medicine list with you and keep it updated. Remember to always discuss any medicine issue with your doctor or pharmacist.
Why do I feel low and anxious at times? Do all people with a heart condition feel like me?
Some people may feel low and anxious at times in the days and weeks after a heart event. Sometimes these feelings last longer. A heart event can be a very stressful thing for a person and those close to that person to go through. In the short term, it can feel like there are many new demands and a lot of uncertainty about how to handle them. In the section on psychological and social health, your Managing My Heart Health booklet provides some more information on the differences between these normal feelings and depression as an illness. Anytime you think you may need help for feelings of sadness or anxiety, or if your score on the Managing My Heart Health booklet depression checklist indicates that you may have depression as an illness, let your doctor or another health professional know. They can then link you in with services to provide the help you need.
I've lost my confidence. How do I get it back?
Again, some people feel loss of self-confidence after a heart event. In the section on psychological and social health, suggested strategies include attending a cardiac rehabilitation program, meeting with a social group, joining a walking group and being physically active every day. These strategies can be helpful in regaining confidence. Have a look and work out which ones you might feel ready to do if you're not already doing them.
Nobody seems to understand what I've been through and what I'm still going through. What can I do about this?
After having been through a heart event, it can sometimes feel like other people who haven't been through this experience can't fully understand what it's like and the impact it's having on you. Some of the Managing My Heart Health Action Plan strategies can also be helpful here. They include talking with people close to you about how you feel to help them get a better understanding, talking with a cardiac team, attending cardiac rehabilitation where you'll meet other people who are going through the same sort of experiences, having people close to you take a look through the Managing My Heart Health booklet can also be a good idea. Remember, help will be available if you need it. Tell one of your cardiac team.
I hope that you found the information in this video useful in learning how to be more heart smart.
It's important to remember, however, that this is the start of your journey and it's up to you now to make the necessary changes to help prevent any further heart events. You can visit the Heart Foundation's website for information on looking after your heart. You will find a range of tools, tips and healthy recipes. Your support network, your GP, your family and friends can all play a role in your road to recovery. However, I would really encourage that you attend a cardiac rehabilitation program.
You may feel different now, but remember, this is a journey and there will be highs and lows. Thank you for watching this video and we wish you the best in your recovery.